This video is about a condition called superior canal dehiscence syndrome. First, we'll make sense of the name and learn a little bit about the inner ear. Second, we'll look at the symptoms associated with superior canal dehiscence syndrome. And finally, we'll talk about diagnosis and treatment. The inner ear has two sections. The cochlea is responsible for hearing, and the vestibular system is responsible for sensing the orientation and movements of the head. The vestibular system has three semicircular canals, one of which is called the superior canal. And the inner ear is surrounded by a bone called the temporal bone. The temporal bone is pretty thin near the superior canal, so sometimes a hole, called a dehiscence, can form there. Superior canal dehiscence is when there's a hole in the temporal bone near the superior canal. You might also hear superior canal dehiscence syndrome called Minor syndrome, since it was first described by Dr. Lloyd Minor in 1998. A superior canal dehiscence causes symptoms in both parts of the inner ear. Normal sounds are not heard as well because some of the sound energy is lost through the extra opening instead of traveling through the cochlea. And the extra opening actually causes internal body sounds, which mostly travel by bone, to vibrate more than normal. So you start to hear sounds that are normally too quiet to notice, such as the pulsations of your brain and the squeaking sounds of the eyes moving in their sockets. Your own voice can also sound too loud. This disruption of normal vibrations can also cause the sensing organs in the vestibular system, which normally only sense motion, to be triggered by loud sounds, causing dizziness. The opening can also cause dizziness by making the vestibular system sensitive to pressure changes, such as when coughing, sneezing, or bending over. When the characteristic symptoms are present, an ear specialist can diagnose superior canal dehiscence syndrome after looking at several additional pieces of data, including a CT scan, a physical exam, a hearing test, and a vestibular system test called a VEMP test. Once a superior canal dehiscence is confirmed, it can be fixed through surgery, eliminating the symptoms. The surgery can take one of two approaches. One route approaches the temporal bone from the top, passing by the brain through an area called the middle fossa. The other route approaches from the side of the head behind the ear through an area of the temporal bone called the mastoid. That's it for this video. More information on superior canal dehiscence syndrome can be found on the website of the UCSF Balance and Fall Center. Thanks for watching.